Why is your mole itching and bleeding? Imagine noticing your mole suddenly becomes itchy or starts bleeding without any obvious reason. This can be confusing and even worrying, but understanding the possible causes can help you decide when to seek medical advice. Moles are common skin growths made up of pigment-producing cells, and most are harmless. However, changes like itching or bleeding can sometimes signal something more serious, so it's important to pay attention. Most of the time, itching or bleeding in a mole happens because of simple, harmless reasons. For example, if you scratch or rub the mole with clothing or jewelry, it can cause irritation or minor injury. This mechanical trauma can make the skin around the mole inflamed, leading to itching or even bleeding if the skin tears. Dry skin or exposure to harsh weather can also weaken the skin around the mole, making it more prone to irritation and bleeding. Additionally, hormonal changes during puberty or pregnancy can sometimes cause moles to grow or become mildly irritated, which might lead to itching. But it's crucial to understand that persistent itching and bleeding, especially if they happen without any injury, can sometimes be signs of skin cancer. Melanoma, the most serious type of skin cancer, often presents with changes in the mole's appearance. If a mole starts bleeding spontaneously or continues to itch over time, it could be a warning sign. Melanomas may also ulcerate, from scabs, or ooze fluid. When these symptoms occur alongside other changes like a change in size, shape, or color, or if the border becomes irregular, it's a sign that you should see a healthcare professional promptly. Age is also an important factor. If you notice new or changing moles that itch or bleed after the age of 30, it warrants extra attention. These changes should always be evaluated by a dermatologist. During a professional assessment, a dermatologist may examine the mole with special tools called dermatoscopes and might perform a biopsy, where a small sample of tissue is taken for laboratory analysis. If the mole is found to be cancerous or suspicious, removal is usually recommended. This involves numbing the area and surgically excising the mole to prevent further spread and to get a definitive diagnosis. Early detection is key in managing skin cancer effectively. If you notice a mole that itches or bleeds without any clear cause, it's best to consult a healthcare professional. They can assess whether the mole is benign or requires further treatment. Remember, most itchy or bleeding moles are caused by minor irritations, but it's always better to be cautious. Regular skin checks and paying attention to any changes can help catch potential problems early, improving treatment outcomes and keeping your skin healthy.